Hi, I'm Dr. Derek, pediatric dermatologist at Paragon Skin. I'm here to talk to you today about infantile hemangiomas. Infantile hemangiomas are a very common birthmark. It's a benign red birthmark. It's actually considered a tumor because it grows, but the good news is this is something that is benign and not generally harmful to your child. The problem is this comes to our attention as in dermatology and pediatrics because these are red bumpy lesions, especially on the head and the neck, and they will grow, and if they're in certain locations, it can be a problem for vision or for feeding, if they're near the eye or the mouth. If they're very large, they can occasionally be associated with certain syndromes. And the other concern is that all of these lesions, even though the natural history for them is to eventually go away, usually by the time of kindergarten, a lot of the times it has changed the overlying skin, so they don't always heal on their own with normal skin. So even though there's the thought that it's a lesion that will go away on its own, we have treatment that can help to prevent it from getting bigger. And it's especially important with these infantile hemangiomas to be able to catch it very early before we get all of that extra growth so that we can have the best chance at treatment success and the best cosmetic outcome for your child. A parent should be concerned that the child has an infantile hemangioma if in the first 2 to 4 weeks of life, you're starting to see this developing kind of red patch on the body, on the skin. So at birth, at least half of babies don't have any skin marks where it's going to be. And then usually by about 2 to 4 weeks, you're starting to see a little bit of a red patch. It might even look like a bruise. And then it just keeps getting darker and often more elevated. Now, usually by a month, it's more clear that there's something going on the skin. And that's the perfect time where I want to see the child because I can start therapy as early as a month. A lot of babies don't have any marks at birth, or there might be just a little pink patch. And then the parents are watching the baby every day, and so you will start seeing growth of the lesion. You'll start to see it get a little bit more red, a little bit more elevated, and a little bit wider. Day by day, you'll see that. Usually by about 4 weeks, it's pretty clear that there's something there, but even after that, it's going to keep growing and getting bigger. For infantile hemangiomas, we are very fortunate that we have a medication that is FDA approved. It's gone through rigorous clinical trials with infants, and this has been out on the market for over 10 years. I've treated hundreds of babies with this safely and effectively, and it's wonderful that we have this option to start as early as a month of age. The important thing about this treatment is that it's more effective the earlier that you start it. The most rapid period of growth for hemangiomas is 1 to 3 months of age. Starting it early is really important to try to get the best outcome and try to prevent further distortion of the skin and further growth of the lesion. And that's something that we can do with our treatment, but it does require really early referral and getting the patient in and started on treatment quickly. For infantile hemangiomas, the FDA-approved treatment is a liquid medication that's taken by mouth twice a day. It's a version of a medication called propranolol. This is a medication that's been used for decades for children and adults for various reasons, for blood pressure, for heart. In the case of infantile hemangiomas, we use it at a lower dose, and we use a formulation that was specifically designed for kids and infantile hemangiomas. It's a formulation that has no excipients in it. It has nothing extra in it. It doesn't have any sugar, and yet it tastes very good. Kids actually like it. It tastes like a strawberry vanilla. And the nice thing is this medication will start working very quickly. Within a week of being on the medication, you will usually start to see a difference. The lesion will get a little bit less red, a little bit more flat, and that's what you continue to see over time. That medication is the gold standard for treatment. The best way to treat is to get it started as early as possible, even at 1 month of age, and to continue it for minimum 6 months but typically we'll want to continue it until about a year so that we know that really most of the growth of the hemangioma is completed, and then start to come off of it. So that's the treatment, which is propranolol is the generic name. The branded name that is the FDA approved version is called Hemangiol. Some parents are concerned with the idea of treating their child with a liquid medication for potentially months at a time. And I do want to reassure you that this is safe and effective, and it's been a tried and true treatment that has great results. Now, there are certain lesions where it's very, very important to treat effectively, and where I think trying other treatment options is not recommended because you're going to want the most effective treatment early on. So for example, a lesion that is around the eye, and if you're not treating it very quickly, the child could have problems with developing their vision in that eye. A lesion around the mouth for feeding, around the ear for hearing, a lesion on the scalp where then you could have a problem with the hair growth, a lesion on the chest, the breast area, where you could then be at risk of having breast tissue aplasia. So there are certain areas where it's really important to use the oral medication. And that is where we have the best data and the best results, is the oral medication. Now, there is a different form of a medication out there, a topical beta blocker. It's off-label. It's not something that's been studied in the rigorous clinical trials, and so it's not something that's FDA approved, but it's something that has been used by many pediatric dermatologists and pediatricians for years. It's an eye drop that we don't put on the eye, we put on the lesion itself, and it can be effective in some cases, but the more that we've used it, the more we've realized a couple of things. It's only effective for very, very small superficial lesions. So once it's really more elevated, it's not very effective. In my mind, once it's more than, about a centimeter squared, more than about that size, it's really not going to be as effective. The other concern that I have is that we know that the medication doesn't just stay there. Some of it is going to get absorbed anyway. And the problem is there's huge variability in the blood levels that you can get with that medication. And so it's important, if you're going to use that medication, if the doctor deems that the lesion is an appropriate one to try it on, that you follow the instructions and don't do too much of it, because otherwise, even with appropriate dosing, there's still always a risk that the child could get higher levels than you would want of the medication, and it's a little bit less predictable. So that's why in almost all cases I reach for the oral medication, because it has a lot more predictable safety data, and I think it's more effective as well. Some additional treatment options besides oral propranolol may include topical timolol, which is a topical solution you could put just on the lesion itself. There's also consideration for using laser, and that's a light therapy, high energy device that targets the red in the skin. I don't generally recommend doing that under 6 months or so during the rapid growth phase, because there can be an increased risk of the lesion ulcerating, and then with that you can cause scarring. So I think it's very important to have that as a consideration, and actually it can be important as an adjunct therapy, and if there's any residual red remaining after the treatment course. The other consideration is surgery. Right? So parents see a big red bump and they say, well, why don't we just cut it out? So the challenge is that you can't cut into the skin without leaving a scar. The oral medication is going to work from within. It's going to preserve that overlying skin, and it's going to shrink down the lesion and prevent further growth. And then in some cases, there may still be some residual lesion, or we call it fibrofatty tissue, some kind of different scar-like tissue, where once they're older, you may need to take that out. If the child was never treated with a liquid medication and there's still some scar remaining at 4 or 5 or 6 years old, then yes, surgery would be an option to consider, but it's almost never the first line treatment, because we now have very safe and effective medication. So an infantile hemangioma is a benign lesion. We think of it like a red birthmark. About 1 in 20 to 1 in 50 babies will actually have one of these. And they're very common on the head and neck, and then less so on the trunk and then the extremities. It's benign, which is a good thing. However, it can be a very large lesion, or it can cause functional problems. So lesions that I would definitely want to evaluate for treatment would be lesions by the eye, because if it's starting to grow around the eye, the child is not going to use that eye for vision, and very quickly you're going to lose the ability to see in that eye. They might then need to have patching of the good eye later, and so it's very important to prevent that. Similarly, you can have problems if it's near the ear or around the mouth for feeding, and you can have problems on the scalp for hair growth or the breast for breast development. Other things to consider are if it's in the diaper area, because that's an area where it may be more likely to ulcerate. Diaper areas or skin folds, because there's friction and there's moisture, and that can, even by itself, run the risk of the top of the lesion getting irritated and then opening up, and that can be very painful, and it can also cause scarring. Other reasons for treating would be very large lesions, think 5 centimeters or more, or lesions that are definitely lesions that are very large on the head and the neck, or in the pelvic or diaper area, because those lesions can sometimes be associated with syndromes where you might need additional workup, for example, cardiology, ophthalmology, kidney, spine. So you might need to see additional specialists and get imaging if you have very large lesions in those areas. The risks of not treating an infantile hemangioma may be that lesions in certain areas of the body, for example in the diaper area or skin folds, they may be more prone to ulceration, where the top of the skin could break down and then it could cause a lot of pain and scarring potentially. Other lesions may be cosmetically disfiguring if the skin continues to distort. There also may be areas where the lesion is causing functional impairment, for example, around the eyes and the ears. There are lesions where if you have them around the mouth or the throat area, for example, it's a marker that you might actually have lesions inside the throat, which could cause breathing or feeding problems, so that's important to evaluate. And then the other concept with infantile hemangiomas is, even if it's a very small lesion, even if it's not on the face, not somewhere that's as visible, we know that most of the hemangiomas, they will go away on their own. About 90% are resolved by age 4. But the challenge is that that doesn't mean that the skin is normal at the end. In many cases, it's still going to leave behind telangiectasias, little fine, vessels, blood vessels, a little pink patch. It might leave more of a firm or semi-firm bump. It might leave wrinkly skin over it. So it's important to know that just because the lesion will eventually go away, it doesn't always mean it's going to leave normal skin. And then at that point, you'll have to decide if that's something where you want to do additional treatments like laser or surgery to be able to revise and do the best you can at that point. So an infantile hemangioma will go away eventually, and we know from the data that it's about 90% by age 4, and they're not really going to come back. When we are treating infantile hemangiomas, we know that we want to treat at least 6 months, usually past a year, because if you come off too early, there's a risk of rebound. And so that can be important to make sure that we're treating for the appropriate duration. You're not going to start forming new infantile hemangiomas, and if you're within a few months or so, usually any hemangiomas that you're going to have will be apparent. It is really important to get a good baseline physical exam and over those first few months to make sure identifying if you have multiple hemangiomas, because that sometimes needs additional workup. Some of the risk factors for developing an infantile hemangioma can be a family history, girls, prematurity, and multiple gestation. Usually there isn't anything that we can point to about the pregnancy that we would have wanted to be done differently. So I really want to reassure parents please don't feel guilty over this, okay? I know it's easy to say, and parent guilt is a real thing, but this is a very common birthmark, and the good news is it's benign and it's something treatable, but it's not your fault. So what hemangiomas do need to be referred? Remember, hemangiomas are very common, 1 in 20 babies potentially. So there is a scoring tool that is available on ihscoring.com where you can enter certain risk factors. And this might include locations such as central face or ear. It might include the size, such as 4 centimeters or larger. And it may also include if there are multiple hemangiomas, 5 or more, and some other features that can help you to decide if it is at high risk for needing additional workup and or needing treatment. So this is something that parents can use, pediatricians can use, and this can help to guide therapy. This is very important for the pediatrician and the dermatologist's office to be able to be aware of so that they can do everything they can to get that patient in as soon as possible. It is very important with infantile hemangiomas to be seen quickly. Time is important because we know that the treatment works better the sooner you start it, and in certain cases you need to make sure you're doing additional workup. And so any pediatric dermatology office where there's fellowship trained pediatric dermatologists should be aware and accommodating of getting patients with infantile hemangiomas in very quickly. I know here at Paragon Skin, we will get your baby in. If you have an infantile hemangioma, we will get you in. Please call, please say that's the reason for the visit, and we will fit you in.